At La Clínica de Familia, we identify MAP program as our medication assisted treatment program. We're working with what we have available within the community and what we don't have available within our community. So we've seen that throughout our community, we have different programs that provide the medication portion of treatment for those that are dealing with substance abuse and are wanting to really work on their treatment and their lifestyle and changing that. What we want to do here at La Clínica de Familia is integrate treatment within the medication. So the program does have to be a voluntary based, meaning that the patient will decide and will be able to move forward on whatever goals and whatever changes they want to make within their life. That being said, we want to integrate the medication portion with the treatment, meaning that there will be a therapist available for them, a case manager, and a peer support worker working with the medication provider and the nurses to be able to integrate that piece of medication and the changes that we want to make for themselves.
One thing that I would advise our legislators across the state, even across the nation, removing barriers for students starts with us, and having willing partners like La Clínica de Familia to do that process and who is willing to work with schools. You know, it's not an easy feat. That is something that we should invest in. If our communities had more partnerships such as, you know, La Clínica de Familia, mental health providers, food services, our students would be ready and prepared to enter a world where they know that they can rely on community. And our legislators need to understand that that requires some infrastructure. It also requires some investment in our monies, but certainly it is a worthwhile investment because it removes barriers for our students. It keeps them in school. It allows us to do the important work we do as educators.
It's important to advocate for our students and our families so that they receive the essential health care and their needs are met. La Clínica does such an awesome job providing, services for mental health, our behavioral health, our medical, and our dental health for our students. Those are all such needed, that's not who I am. It's so important that we advocate because healthcare should not be, should not be a privilege. It is a right for everybody to have health care.
The Centering Program at La Clínica de Familia Women's is an exciting program for prenatal care that is a little bit different than our traditional prenatal care model. In traditional prenatal care, women have individual one-on-one visits with a provider throughout their pregnancy. In the Centering Program, women with similar due dates have group visits that last about 2 hours each with the same provider for the duration of their pregnancy. This gives women more time to ask questions, more time for counseling, more time to grow together and celebrate their pregnancy with a group of women that become a support system throughout their journey. We are really excited to be expanding our women's health and preventative health care services in Southern Doña Ana County. We have a lot of patients that come to us in Las Cruces from Anthony, Chaparral, Sunland Park, and transportation is a challenge. Childcare can be a challenge, time off work can be a challenge. To be able to provide those services closer to those patients is a huge win for our community. Those services are going to include prenatal services, birth control services, including IUD placements and Nexplanon placements, and additional well woman care.
I do have some asks for legislators and something to pay attention to. I think number one is FQHCs need to be protected. FQHCs are, like I said, already a large provider to care in the communities. But they also are important because they are a large provider and sometimes the only provider to our underserved populations, right? And we need to be protected in that because the care we provide is substantially subsidized. And in the absence of that, it would harm our ability to care for the patients that we do in the community. So I think that's really important, protecting the FQHCs. One simple way to protect FQHCs is ensuring that our 340B pharmacy work continues. And 340B pharmacy is a way that medications are subsidized, and that way we can provide medications at a lower rate to our patients. And the money saved is reinvested into the FQHC. So we can continue even more services and provide care for those who can't afford any medication, for example. There's a lot of things that we can do. So a simple protection that's being done is to protect our 340B pharmacy status, because we are currently nationwide under, I guess, I don't want to say attack, but under some sort of duress by pharmaceutical companies that don't want to participate. And if pharmaceutical companies aren't participating and we don't have protections, that could harm our ability to provide reduced medication costs and reinvestment of these funds into caring for those same patients.
So the vision for La Clinica moving forward is to ensure that there's access to care and there's a place that our patients feel comfortable about visiting and ensuring that they're getting the best quality of care out there.